Dr. Ashwini Naidu. She will be joining us through a remote mechanism. And Dr. Ashwini Naidu is actually the co-founder of Avisa Smart Hospital in New Delhi. And she's going to talk on, do smart hospitals enable operation to be streamlined? So how you can streamline your operations? Do you want to make them quite smart? But in the journey to be smart, you should not get here and there. So she's going to talk on that. Yes, thank Dr. Ashwini. I'm handing the floor to you. Thank you.
Thank you. So, firstly, I would like to say that it was a wonderful presentation that was done by Dr. Dilip. And I of course, excited to be back again on the Smart Hospital conference. And I really apologize because of some situation I couldn't be there. So, I think we can start with the presentation. Right. So, today I wanted to talk about how smart hospitals enables the operation to be streamlined. So rather than taking you into what is a smart hospital, I would rather try to focus on how a smart hospital will help you in terms of operational excellency, efficiency, improve patient-centric care, and the targeting audience for me are mostly the medium-sized and the small-sized hospital because they are the ones who actually grapple with a lot of hassles, right? So when we talk about smart hospital, the first thing that comes into anyone's mind is that smart hospitals means technology. Yes, it does leverage technology, but along with technology, we also leverage a complete medical infrastructure, which includes a combination of hardware, software, medical devices, remote patient monitoring devices, but also with required manpower and resources to streamline and improve the hospital operational efficiency as well as improve patient-centric care. So, when I talk about smart hospital, I'm saying that, with technology, you require manpower and resources. Why? Although we have multiple hardware or software or multiple things into place, there are many kind of people, many sections of people, be it a young age or an old age, who doesn't still understand what is happening with the technology, who doesn't know how to operate a technology. Even if I talk about a hospital, owners and all, they don't understand what is going where. So if there are manpower such as IT admin or patient care coordinator, the patient care coordinator can actually help the patients to understand the process, the flow, whatever is going on, how to use a remote patient monitoring device, how to help it to increase their patient education or awareness, how it will help them in chronic disease management, etc. And when I talk about the operational efficiency, there are multiple aspects included into it. So I, as a hospital, I cannot just focus on the technology aspect, but also I need to know that I have a required resources or I have the required manpower. For example, if I'm a 20-bedded hospital, even if I am having a normal good doctors on the board, but I'm not getting enough revenue, I need to analyze through accounts person or through a CEO or a CO that, for example, my budget for this particular department is 20 lakhs, but I'm just generating 2 lakhs out of it. That means there is some gap. It can be doctor, it can be patient. So you need to take person who are, for experience in the operational aspect, in the finance aspect. We need someone who will do thorough audit of the hospital to actually find the minute gaps which are in the hospital and to help in increasing the overall efficiency. Now, when we talk about the technologies, what are the technologies that are used and how it helps us? So technologies such as AI and ML, blockchain, data cloud, this actually helps us in understanding a specific disease pattern, which also helps in early diagnosis. Remote patient monitoring is going to help us with chronic disease management for patients who has BP or diabetes, teleconsultations. Mobile health apps are something which is on the increase on day-to-day basis. Again, this is going to help patients with multiple services in a single platform, and this also gives them a comfort and a care. If I, as an hospital, is providing a comfort and a care to a patient, that means I'm retaining the patient and I'm reducing the bounce rate. So the patient will be bound to come back to me. So from a hospital perspective, I need to focus on the overall inefficiencies, the gaps in the hospital, improvement in the patient care, improvement in the patient services, and patient-centric care as well. So if you look at the main points of any patients that is there in any hospital, of course, this depends on hospital to hospital. It's not necessary that every hospital will have the same pain points, but these are some of the pain points which we have categorized. Which are categorized in terms of OPD and IPD. Now, why I am showing you and telling you this is you can actually audit your hospital and find these gaps, which will actually help you to improve the efficiency and the services. And for this, again, you don't need to deploy a lot of resources, or don't need to spend so much. Small points which you can find. For example, if you do know that the patient services are not better, or there is no redressal of complaints, you can have a patient care coordinator. If there is a long queue, you can do a queue management. For a patient satisfaction and reliability, you can have a customer care. So various things could be put together. When we talk about IPD patients, availability of the beds, so this can be solved very easily. So you can have a small website for yourself where you can talk about the doctors, the facility. If you have an app, it's okay. If you don't have, you can put in the entire details in the website itself. Because I, as a patient, I'll always look at a cost. So for tackling with this situation, you can always tie up with various patient financing companies. There are companies called as Early Salary, Save In, Easy Hospital, many such companies. So what they do for any what they do is for any patient who are not capable of paying the surgical fees or the treatment fees, this patient financing companies does a financing for them with zero interest EMI. And however the CIBIL score is, be it low or be it high, they provide the finance to the patient, and the amount for them gets disbursed in 24 to 48 hours. Now, again, here you're helping the patient in one way. You're retaining the patient. The patient is okay, in this hospital, I'm getting an extra service and I'm getting a complete procedure from end to end. They're helping in all sorts of services. So this is how I'll recommend others also that you have to go there, right? When we talk about the discharge, there is a lot of delays in the discharge happening. It can be because of approvals. If we simply have a very quick automated system, for example, if it's this insurance, these are the number of documents that has to go. For pre-authorization, what is required? Automated discharge template, automated insurance template. Again, this is going to help with a quick discharge. And the most important part is any patient who goes back home does not get follow-up from the hospital side, which actually bothers them. Again, if you could have just a simple one person also, a customer care or some solution in which you're following up the patient, because once you follow up the patient will come back. Again, you're retaining the patients, right? So how do we provide this journey to the patient? We need to focus on patient acquisition, but also retaining them, right? We need to focus on the queue management. So be it any big hospital from Apollo to Max, people still have to stand in long queues. So that is the reason for many of the people doesn't even go for OPD appointment even if it is required. But if there is some solution, which for example, a QR code or something which you scan and your details get automatically displayed, which Avisa has come up with, I'll be showing in the next slides. But such measurements, or if you are a small scale hospital, you can simply have a tabloid or a kiosk wherein the patient can register themselves and get the number. So queue management, again, here you're giving a patient comfort, you're reducing the waiting time. So again, this is going to help with acquisition of the patient, reducing the bounce rate and the leakages. So this again plays a very important role, because if 100 patient is coming to your hospital for OPD, out of that, maybe only 30 or 40 are availing your services, and lab and pharmacy are the major revenue sources for any hospital. And if I'm losing out on the patients, if I'm having bounce rates, that is my revenue leakage. So I need to find that. And through HIS, it is very possible to identify the bounce rate and revenue leakages. Also, we as Avisa have developed a system in which any doctors who writes a prescription, the notification goes automatically to lab and pharmacy. Now this will help that, for example, I'm a doctor A, my this number have patient have gone to lab, I have this much bounce rate, I have this much revenue leakage, and I as a doctor is making how much revenue. So all this will help you in planning the, financial aspects of the hospital and improving the services and cutting down the revenue leakages. Another major source of revenue leakage is the supply chain of the hospital, that is the pharmacy and the consumables. If at all we have a system in place which actually kinds of, from a manufacturer to the distributor to the patient, if there is a system in place which knows that a number of medicine is this much, this is the expiry. So if we have an automated supply chain system, we can actually cut down the revenue leakage also. And second is to actually have a good supply chain management or a good pharmacy supply chain person in the hospital to help us maximize the profit margin, but at the same time keeping intact the quality of the medicine, which is quite possible. Then is the real-time tracking of the data. So when I say real-time tracking of the data, this is in concern to the remote patient monitoring. So I, as a patient, if I'm having a BP or a sugar, I have some device which maintains all of this data in a single app. I can consult the doctor through teleconsultation, or I can go them and show it. So the doctor will also have a better idea. Again, here you're helping up with the patient care and services. Digitalization of records, it will actually help in the automation of the entire system. The digital presence, the digital marketing again is something of utmost important nowadays, because each and everything is becoming digital. Everyone is on social media or website. So I, as a hospital, if I will make my digital presence known, this is a very good way of generating leads and getting patients, promoting your doctors, promoting your services, promoting your hospitals. So the digital marketing aspect is something which we have to start focusing on, which as of now most of the hospital doesn't do. Offline marketing, yes, it does work with the referral and everything, but digital marketing again is one of the growing era, and it actually helps a lot of hospital gain momentum and increase number of patients. Also, when you have a one-stop solution for all of the patient care services, you have diagnostic, pharmacy, insurance, and home care. And if at all there is an app in which all of the services is together and it is in your hospital, so a patient can avail all the services at one platform. Patient counseling and education, again, it becomes a very important aspect to give them, counsel them about their disease or their condition, give them awareness. And the last is the digitization, the automation. So when there is a complete digitization, there is automation of the process of the hospital. When I say automation of process, it includes everything from the discharge process to the admission process, from the patient care services to the registration process. When this process keeps on improving, it keeps on automating, you will have an increased operational efficiency, and hence in this way you can convert your hospital from a traditional hospital to a smart hospital, right? So just I wanted to give you a very quick brief about Avisa. What Avisa actually means, giving life. So we actually have successfully transformed traditional hospital into smart hospital. So we have different kinds of services together, which includes hospital, labs, diagnostic, pharmacy, smart health card. So we have an app which is called as a Avisa Smart Health Card. So this app actually can be integrated with any of the hospitals. And this is a one-stop solution for the hospital, in which this app has all the services: lab, pharmacy, home care. So from I, as a patient, if I am coming to your hospital, I can just download this app, which can be co-branded with your hospital name as well. And again, the patient will have a comfort and care. So actually the intent of us coming out with this ecosystem was to resolve the pain points of the different stakeholders in a hospital, be it a hospital, be it patients or a doctor. So our model is actually based on, that either we do a monthly subscription fees or we do a revenue sharing. Also, we have also taken a step ahead, and we also do an operate and manage model in which we completely take over the hospital and we operate and manage the hospital, and we turn it into a smart hospital, and it grows with us as well. So this are our board of directors. So this is the app I was talking about, which again, as I said, could be co-branded with your hospital name. So the first and foremost thing is the patient can book appointment at home itself. He does not have to come to the hospital for this. So again, here we are cutting down the registration time for the patients. You can, so this QR code which is generated is actually your details. So all of the details, it's your unique QR code. So when I go into the hospital, I just have to scan this QR code and all my details will be automatically be there in the registration module. This is again cutting down my time, the registration time and the waiting time. I can live track my appointment. I can avail ambulance services, medicines, tests. I can avail telemedicine. I can store all of my records. And the second part about it is whatever prescription is generated for me in the Avisa Smart Hospital will be automatically coming back into the app as well. So even if the patient is losing on the prescription or anything, he still will have a data. Along with the prescription, all of the lab reports or whatever reports are generated will be there in the app. We are also giving a TPN, so this, as I told you, the automated TPN CGS solution. We help the hospital with those also, which helps actually in quick discharge. We also have a 24/7 live support through the app in which the patient can call and ask for any kind of and all kind of queries. And we also do patient follow-up. So this is the patient journey if you look at. So I just have to scan my code, my details get registered, my appointment is fixed. Then we have a medical IoT device. Again, the beauty of this device is it can capture all of your vitals plus 30 plus blood tests. So again, here we have done automation and digitization. When I walk in here, whatever report will generated will go into the EMR, the vitals as well, the reports generated. The nurse doesn't have to write anything down. Then going to the doctor, we have given a doctor a digital prescription, but again, it's a simple pen and paper, which is going to be digitalized into a prescription. So here we have maintained the comfort of a doctor. And the beauty of this prescription is there are various sharing options. Just give me a minute. The beauty of this prescription is there are various sharing options wherein when you click on share, the patient education videos or brochures will automatically go to the patient's mobile number and to the Avisa app as a link. And he can also record his audio and give any audio recordings or instructions to the patient. So here we are covering the patient education, the awareness, which usually the doctor does not have time for. Along with digitization, we have also maintained the comfort for the doctor to write in a pen and paper. And all this data is safe with the doctor. The data privacy is maintained. This data will only be with doctor. It will not be with Avisa. It will not be with anyone. He can actually see that I have for my patient how much revenue I have generated, how many patients have availed a lab service, how many patients have availed pharmacy services, how many patients have availed radiological services, whichever are in the hospital. And again, with this prescription, when you press on pharmacy or lab, the notification will go. So you do not have to go back again into the registration counter. All you have to do is simply walk into the pharmacy, scan your QR code, buy your medicine, go home. Same is with the lab. So this is your journey. So through automation and digitization, we are actually helping. So basically with the concept of smart hospital, we are helping in smoothing the patient journey. We are automizing the hospital, digitizing the hospital. We are increasing the operational efficiency. We are cutting down the revenue leakages and the bounce rate, many things put together. So that's it from my end. Questions, if any. Thank you.